Welcome to Rebel Chaser. My name is Gail, and this is part 2 of the State of Tennessee versus Sarah Fuson trial in Judge Wolf's court. She's the daycare worker, and today was kind of a technical day, or this morning at least was kind of a technical morning. I'm doing today in 2 parts, so the morning will be part 2, the afternoon will be part 3, just because I didn't want to do it all as one. But let's see. You guys will understand it. It's not so far above your head that you can't understand. In fact, it's very understandable. They did a really good job of making it understandable for the jury. So I'm sure you guys will understand. And then part 3 will be the afternoon. I'm going to try to get part 3 done today, but I'm looking at my clock and it's already 8:45 at night. So I'm not positive, but I'm going to try to get it done this evening before I go to bed. So I'll let you guys watch part 2.
Then we are ready for the juries. Now, are these the expert witnesses that you're going to be calling now? Because the defense expert witnesses were wanting to sit in or be in on Zoom.
All right, I'll be calling 2 witnesses.
All right. So you're going to call 2 fact witnesses before experts. All right. Bring the jury in. Good morning, ladies and gentlemen. Thank you for all returning for our trial. So we are ready now to continue with the state's proof.
Mr. Caleb here. Good morning, sir. Could you please introduce yourself to the jury and spell your name?
Yes, sir. My name is Caleb. It's C-A-L-E-B, and my last name is Sherman, S-H-E-R-M-A-N.
Thank you, sir. Where are you currently employed?
I am currently working over at Jarrett Concrete.
Where were you employed in January of 2023?
At the Office of Child Safety in Nashville, Tennessee.
Is that considered DCS or Department of Children's
Yes, sir.
Services? Okay. Could you just give the jury an overview of what DCS does?
So in my division, we worked abuse cases where somebody was in a caretaking role with a child.
How long were you with DCS?
Approximately 7 years.
And what roles did you have while you were at DCS?
I was an investigator when I started working local cases. Those cases were abuse allegations where the parents were the perpetrators. Then went to central office, did case assignment jurisdiction, and then I went to work in the special investigations unit.
Is that also called SIU?
Yes, sir.
And what kind of cases does SIU handle?
We predominantly work cases where anybody's in a caretaking role or in a professional role with a child and there's an allegation.
So the role is different if the allegations are against someone other than the parent, is that what you're saying?
Yes, sir.
Okay. What do you do differently? How do you handle that investigation differently, if any way?
We would still work them the same, it's just in a different capacity.
Okay. As far as DCS's ability to remove the child, obviously that's not an option if that's not the parent.
Yes, sir.
Is that what you mean?
Correct,
Okay.
yes, sir.
Okay, and yesterday, I'm sorry, let me backtrack. Just explain a little bit how a general investigation would work. What would you do on an investigation?
So typically we would get a phone call, we would go through the child abuse hotline. From there, they use a measuring tool to decide if it meets criteria, it doesn't meet criteria. If it does not meet, it gets screened out and doesn't get picked up. If it does meet criteria, it would be assigned to me.
Okay. So yesterday during jury selection, we talked a little bit about the SIPIT process. Could you explain to the jury what that is?
Yes, sir. Typically when we get a case, if there is allegations that are, we call them severe, if there's extensive bruising, it could be a sex abuse case, anything that's considered severe abuse, we would utilize SIPIT.
Okay. And then who all is present for SIPIT?
It'd be the CAC, their attorneys, detectives, captains. They would assist us in the case.
Sherman, would you scoot up a little bit to that microphone?
Oh, yes, sir.
or
My apologies.
Well, that's all right.
And then at this SIPIT process, is a recommendation made as to how to handle the case or what to do with the case further?
Yes, sir.
Okay. How would a, speaking generically, how would an investigation with DCS that SIU handles, how would that be concluded? What would happen?
In this particular case,
Just, or in general, yeah.
So if we did get the case and there was concerns with severe abuse, we would notify SIPIT, and at that point, they would assign a law enforcement agency.
Gotcha. Okay, so let's get more specific then. Did you investigate the case in January of 2023 that involved Ms. Sarah Fuson and Olivia Hyde?
Yes, sir.
Okay. How did you receive notification that you were assigned that case? Do you know?
Through the child abuse hotline.
Okay. What did you do when you first got the case?
I notified her supervisor and then to make contact with the parents.
Okay. You spoke to the parents.
Yes, sir.
What did you do after that?
I also went out to the daycare to interview the director.
Did you speak to the parents in their home, if you recall?
Yes, sir.
Sorry. Did everything appear normal in the home?
Yes, sir. No concerns.
Okay. Then you went to the daycare, you said?
Yes, sir.
What did you do at the daycare?
I spoke with the director and also got pictures and a video.
Okay. We watched some video yesterday. What was the video that you saw?
It was with Ms. Fuson in the room with a child that was on a cot.
Okay. And what did you see on that video?
It looked like she,
Your Honor, I'm just asking.
Hold on a second. You objecting? The objection is for him interpreting the video because the video speaks for itself. Any other basis upon which you would want to introduce?
I'll move on, Your
All right,
Honor.
I'll sustain the objection.
What did you do after viewing the video?
I notified my supervisor of what was on the video and the pictures, and that's when we determined we would need a law enforcement agency involved and notify SIPIT.
Okay. And then did you contact law enforcement or how did that work?
I sent an email to Detective Pendarvis.
Okay. And did you communicate with Detective Pendarvis?
Yes, sir.
Okay. And then at that point, was your investigation pretty much concluded?
Yes, sir. Once law enforcement gets involved, we let them take the lead. When I did send that to Detective Pendarvis, he worked with law enforcement and there might be a conflict of interest, so they would have to get TBI involved.
Okay.
And that was the end of my part.
And does DCS make a classification as to how did you close this case out? What were the findings that DCS made?
The findings,
Turn your microphone on, please. It's not on, so.
Oh, I'm sorry, Judge.
That's all right.
Forgive me. It's a hearsay objection. Obviously, this testimony is based on the investigation of others.
He investigated the case, Your Honor. I'm asking him how he classified he wrote the report. I'm asking him how he closed this case out. It's not-
Overrule the objection. He's basically testifying about what his investigation resulted in, so I overrule the objection.
How did you close this case out? What was your determination?
we substantiated.
What does that mean?
So with ours, we don't do the criminal side. So with a substantiation, it would keep her from working with children, daycare, or schools.
And then that would go into a database?
Yes, sir.
And you say her, you mean Mrs. Sarah Fuson?
Yes, sir.
If I could have one moment, please, Your Honor.
You may.
Further questions?
All right. Mr. Strains, you would wish to cross-examine?
Just very briefly, Your Honor. Good morning, Mr. Sherman.
Morning, sir. How are you?
Good. Do you remember the date that you were brought into the case?
No, sir.
Okay. And you received, I think you told the jury, a call to the hotline at DHS?
DCS.
DCS?
Yes, sir.
Okay. Do you remember when you received the call?
No, sir.
And do you remember who called you?
No, sir.
Okay. Did there come a point in time early in the investigation that you heard that there was an allegation of a skull fracture?
Yes, sir.
And who did you hear that from?
I believe it was Dr. Lakin or our safety nurse, Thomas Spiller.
And how long were you investigating the case?
I don't recall unless I have my papers in front of me.
Did you appear before the Davidson County Grand Jury
No, sir.
and testify?
No, sir.
I should have said the Montgomery County Grand Jury.
No, sir.
You did not. And you had no role in selecting the charges that went into the indictment.
No, sir.
That's all.
Redirect. Thank you, sir. You may step down. You may have a seat in the courtroom, or you may leave if you'd like.
Yes, sir. Thank you.
Mr. Holder, you may call your next witness.
Good morning, sir. Could you please introduce yourself to the jury and spell your name?
I'm Detective Alan Pendarvis, Allenpendarvis.
Thank you, sir. And where are you a detective?
I'm employed with the Clarksville Police Department.
How long have you been employed with the Clarksville Police Department?
A little more than 16 years, I believe.
And how long in your current role as a detective?
I've been with the Special Victims Unit for right at 10 years.
And what sort of cases does the Special Victims Unit investigate?
A variety of crimes, typically child abuse, child sex abuse cases with adults, human trafficking, child exploitation, things of the sort.
If you recall offhand, how many child abuse cases have you investigated?
I'd say a good average, some more than less, a year, maybe 1,000 in my 10 years that I've been there.
And you were working in this role in January of 2023, is that correct?
Yes, sir, I was.
Okay. Did you receive a call from DCS about a case involving Sarah Fuson and the victim Olivia Hyde?
Yes, sir. I'd initially received an email from Mr. Sherman.
Okay. And what did you do upon receiving that email?
He had sent me the email, had a very brief synopsis about what all he had done, and it included a few photographs and a couple videos from the child care center.
Okay.
So after reviewing those photos and videos, it was also described the relationship of the potential suspect with the sheriff with Montgomery County. So,
I'm sorry, when you say potential suspect, are you talking about Sarah Fuson?
yes, sir, I am.
Okay. And what do you mean by the relationship?
In that email, it had described that she was the daughter of the sheriff.
Okay. And what did you do as a result of learning that? Anything?
Yeah, after watching the videos, I went and consulted with my supervisor to talk about the possibilities of there being a conflict of interest in the case. She had then consulted with her chain of command, which ultimately ended up with a request at the district attorney's office to submit a request to TBI for them to investigate the case.
And why did you feel, I'm sorry if maybe you already explained this a little bit, but why did you feel the need after watching the video to go consult with your supervisor?
The videos were quite shocking at best. I've worked several of these, and after watching the videos, I was fairly confident that if we had worked the case ourselves, there was a good chance that charges would pursue after watching those videos.
If Miss Fuson was not the daughter of the sheriff, what would you have done differently?
Still would have worked the case and still would have pursued charges just based on that initial.
But you would have not gone to your supervisor?
I mean, I consult with my supervisor
Okay.
quite often so she's in the loop of what we're tracking as well.
So to avoid any potential conflict, you wanted to make sure we had a neutral third party?
Correct.
Okay. And did you just cease all your
Yes, sir.
investigation?
I believe I got that email from Mr. Sherman around 3 p.m. that afternoon. By the time that the word had made it up to our chain of command and the district attorney, I was advised at about 5:15 that a request had been made to TBI and not to do any additional tasks until we got 100% word from them that somebody was going to be taking the case over.
So you had the case for one day?
I had the case for a couple hours.
Couple hours.
Yes, sir, between 3 p.m. and about 5:30 p.m. Just about the only additional tasks that I did in that case during that time is after watching the videos, I did call Mr. Sherman to ask if the child had received a medical from any staff. He had informed me that the mom of the child was a nurse, but he had returned the phone call just shortly after my initial phone call with him and said that they had scheduled a meeting with Vanderbilt the following day.
Okay. So you did that out of an abundance of caution based upon what you saw in the video?
Yes, sir.
Okay. I have no further questions for this witness at this time, Your Honor.
Stranger, you wish to cross-examine?
Yes, Your Honor, just very briefly. Officer Pendarvis.
Good morning, sir.
I think you were brought into the case January the 18th of 2023, is that right?
You're correct, sir.
And it was referral from Caleb Sherman, who worked for the Department of Children's Services, is that right?
That's right.
And you were in contact also with Jonathan McGowan at TBI, is that right?
The following day, yes, sir.
Okay. And it was Investigator Sherman with the Department of Children's Services that suggested to you that there had been a finding of a hairline skull fracture, is that right?
Yes, sir. He had called me the afternoon of the 18th the morning of the 19th. I told him the 18th that, hey, I'm probably not going to be working this. It sounds like TBI has been requested. So he had called me the morning of the 19th to give me news that Vanderbilt had potentially found a hairline fracture, and he was asking who the agent in charge that he needed to report this information to.
But you didn't see any written report
No, sir.
that corroborated that in any way, is that right?
That's correct.
And that's what motivated you to pick up the phone and contact the parents of Olivia Hyde, is that right?
I don't recall contacting any parents of Miss Hyde.
Aren't you the individual that suggested that Olivia should be brought to Monroe Carroll Hospital at Vanderbilt for?
I did suggest to Mr. Sherman to set up an appointment for her. Yes, sir.
Okay. And that was based on sort of this circular discussion of Sherman telling you that he had heard that there might be a skull fracture.
Me contacting him and asking for the medical?
No, you making the suggestion to Mr. and Mrs. Hyde that they have the child brought to Monroe Carroll.
I don't recall ever speaking to Mr. and Mrs. Hyde. I'm not saying I didn't, but I don't recall that.
Okay. Who is it that would have suggested that they go to Vanderbilt Hospital?
I suggested to Mr. Sherman after watching the videos that the child be checked out.
But you never saw any sort of a medical report, a CT scan, anything that conclusively stated that this child had suffered a skull fracture?
No, sir. By the time Mr. Sherman called me and informed me of what he had been told, I told him I was no longer going to be working the case, that Agent McGowan had contacted me, and I gave him that contact information to provide that info to.
Thank you.
Yes, sir.
Redirect. Thank you, Detective. You may step down. You're free to go. Holder, you may call your next witness.
State calls Dr. Karen Lakin. Good morning, ma'am. Could you please introduce yourself to the jury and spell your name?
Yes, I'm Karen Lakin, and it's Karenlakin.
Thank you, ma'am. I'm going to pass up. Can you tell the jury as I'm passing this up, what is your profession?
Your Honor, may we approach one moment?
You may. There's other experts that are going to testify. The rules allow experts, other experts, to also sit in on the testimony of one expert. Anyway, it's a rule that we allow. And one of those experts that's going to be testifying later in the case is going to be on Zoom, that they won't be shown, but they want to be able to listen to the testimony. And that way they can formulate opinions and so forth. So we're going to ask you to step across the way until that expert is in on our Zoom meeting, and then we'll go from there. Doctor, if you want to step down and have a seat in the audience.
Okay.
As soon as this individual is in our meeting, then we'll resume with court, but in the meantime, I'll step off until that time. So, thank you, ladies and gentlemen, for your patience, and we've disposed of a matter in your absence unrelated to this case. So we are now ready to recall the state's witness. So, Doctor, if you'll come back up. I believe you already swore in, correct? You were previously placed under oath, so I would remind you that. You were, I think, about to talk
Yes, Your
about
Honor.
her CV.
Yes, Your Honor. Well, I'm going to start over if that's okay. Could you please introduce yourself to the jury?
Yes, I'm Karen Lakin, and it's Karenlakin.
Thank you. And could you please tell the jury what your profession is?
Yes, I am Associate Professor of Clinical Pediatrics at Vanderbilt University Medical Center. Actually, I'm supposed to say Monroe Carroll Jr. Children's Hospital at Vanderbilt. And I'm also the section head for the Child Maltreatment program and the medical director for what we call the care team, which is the consultative team at Vanderbilt whenever children come in with traumatic injuries.
Okay. How long have you been a pediatrician?
I've been a pediatrician now for 20, no, actually now it's, 29 years.
29 years.
Yeah.
Do you specialize in a particular field of pediatrics?
Yes.
And what is that?
Child maltreatment. We actually call it pediatrics is the official terminology.
Okay. How long has this been your area of expertise?
I've actually practiced in the field for the past 24 years now, and first as a consultant, and then I developed the CARES team at Le Bonheur Children's Hospital in Memphis, Tennessee. So I became the medical director there in 2006.
Could you please describe your educational background?
Sure. My undergraduate degree is from Duke University, and I have a master's degree in public health from the University of North Carolina, Chapel Hill. And my medical degree is from East Carolina University in Greenville, North Carolina. My residency was at Le Bonheur Children's Hospital in Memphis and the University of Tennessee.
And could you please summarize any postgraduate work as a pediatrician prior to your current position?
I was a general pediatrician with the Raleigh group in Memphis, Tennessee for 3 years. And then I joined the faculty at the University of Tennessee as a general pediatrician in the Department of General Pediatrics. And then I started working in the field of pediatrics.
Have you previously been qualified as an expert in the field of?
Yes, I have.
Do you know how many times?
Over 100 times. Yeah.
How many counties, if you recall?
Most of West Tennessee, about half of Middle Tennessee, a few counties in East Tennessee, and then also in about 6 additional states.
And have you previously been qualified as an expert in Montgomery County, Tennessee?
I have.
How about Dixon County, Tennessee?
I believe I have also in Dixon, yes. Yes.
And as, Your Honor, at this time, I would offer Dr. Karen Lakin as an expert in the field of child abuse
Any
pediatrics.
questions?
All right, I just had a few questions.
All right. In qualifying an expert, both sides get to ask questions before the court makes a determination regarding the qualifications. Mr. Strines, you may question the witness.
Morning, Dr. Lakin.
Hi.
Your report that you prepared in this case indicates that you've been declared an expert in a number of states. Is that right?
That's correct.
And one of those states is the state of Mississippi. Is that correct?
That's correct.
And do you recall testifying in a case styled State v. Joshua Clark
I do.
back in 2018?
Yes.
And that would have been a case that involved an allegation of shaken baby syndrome.
That's
Is
correct.
that right? Back
Yes.
when that was really a big topic in child abuse. Is that correct?
It's actually still a very prominent topic in child abuse.
And there was a conviction in that case. Is that right?
Yes,
And it was based in large part on your testimony. Is that correct?
that's correct.
And if you recall, the Mississippi Court of Appeals found that your testimony in that case was so unreliable as to be inadmissible.
That's not my understanding of the finding.
Now, it was later changed by the Mississippi Supreme Court. Intermediate Appellate Court did find your testimony unreliable.
No, that wasn't, it was actually whether or not the judge, my understanding is whether or not the judge should have allowed my testimony. So I wouldn't say that that was the,
Well, that's what the Mississippi Supreme Court said.
yeah, right.
But what the Intermediate Appellate Court said was that your testimony was unreliable. Do you remember that?
And again, I'm not a lawyer or a judge, so my understanding is that all of that transpired through the courts, but ultimately it didn't change anything.
That would have been a pretty significant finding against your testimony.
If it had been upheld, it would have been, but it wasn't upheld.
That was made by the Intermediate.
Correct, but it wasn't upheld, so
And it's only a few years ago, correct?
That would be 7 years ago.
And you never read the opinion of
I read parts of it, but it's so much legal terminology and that it was,
do you remember seeing the word unreliable?
I'm sure it was in there,
And you remember that the case was initially reversed?
but it was not upheld. It was then not upheld.
And I fully acknowledge that.
Yeah.
I'm just making the point that he
I would not state that that's actually ultimately what that finding was. I don't agree.
Now, those are my questions.
You may.
Your Honor, based on
Hold on, make sure that door is closed.
Based on the ruling, and I've got a copy for the court, if you need it, if the case is State v. Joshua Clark, it is a Mississippi case. The Intermediate Appellate Court in Mississippi reversed the conviction based on the unreliability of Dr. Lakin's testimony. The court has permitted me to conduct a voir dire of her here in open court in front of the jury. I think that finding by the Mississippi Intermediate Appellate Court casts some doubt on her qualifications to appear as an expert in this court. And I think it affects her credibility in the sense that the Intermediate Appellate Court found that her testimony to be so unreliable as to be inadmissible. Based on that, for the record, I'm asking that the court not declare her to be an expert in this case.
Holder, you wish to respond? Mr. Moore?
Briefly, obviously, as the court knows, the intermediate appellate opinion reversed by a Supreme Court is for nothing legally other than, obviously, he'd be entitled to say, isn't it true that intermediate court said such and such? Fine, he's done that, which I submit is more akin to a question to be asked on cross-examination, has nothing to do with her qualifications to be admitted as an expert. That would go, if anything, to the weight of her testimony, not to her credentials.
First of all, we are not in the state of Mississippi, and I don't credit the the Intermediate Court of Appeals in Mississippi's opinion as to whether or not, for two reasons. One, we ain't in Mississippi. Two, is the fact that we are not dealing with a shaken infant syndrome. I have had experience in that type of a case as a trial lawyer representing someone who was charged with that same type of an offense. So I'm well familiar with the shaken infant syndrome and the ever evolving diagnosis and treatment of those types of injuries. But I can tell you that because this is not a shaken infant syndrome case per se, or at least it's not to my knowledge, then we are not dealing with that particular thing. But I also agree with Mr. Moore that the questions that have been raised don't go to her qualifications as an expert witness. They might go to the weight to be given to her. And frankly, I probably should have had the jury step out before this voir dire of the expert witness occurred anyway. So I'm going to bring the jury back in, and I'm going to qualify this lady as an expert in the field of child abuse pediatrics. Is that the area of her expertise?
Yes, sir.
And I'll instruct the jury that they are to disregard any questions regarding her qualifications that were raised by some issue regarding the state of Mississippi, and that as far as this court is concerned in the state of Tennessee, she's qualified as an expert. That any evidence regarding those other issues could be considered by them as to the weight to be assigned to that testimony rather than her admissibility of her opinions.
Thank you.
All right. Bring the jury in. Ladies and gentlemen, in your absence, I considered an issue and an argument of counsel regarding the qualifications of this witness. As I instructed you in my initial instructions, it is my responsibility to apply the law that the state of Tennessee allows in this situation. This issue that was raised regarding the doctor's testimony in a case in Mississippi in this court's opinion, do not affect her qualifications as an expert in the state of Tennessee. I have considered the argument, and I am ruling and ordering that this witness be considered to be an expert and qualified as an expert in the field of child abuse pediatrics for the state of Tennessee. The issue that was raised regarding her opinion in a different case outside of the state of Tennessee may, if it's raised again, may be considered by you as to the weight to be given her testimony and whether or not it is to be, how much weight to assign to her testimony. But it doesn't affect her qualifications as an expert in this field, and I am therefore instructing you that she is qualified as an expert in the field of child abuse pediatrics. Now, I don't know if the council will approach the bench, please. Trying to avoid you having to walk. I know you like the exercise you get from walking across the hallway, but I'm trying to avoid that as much as possible. So rather than trot you out across the hallway and then trot you back in, I showed this to the lawyers, and everybody agrees it's a permissible question to be asked, so I'm going to allow one of the lawyers to ask that question.
Yes, Your Honor. Thank you. The question was, how many times have you been called as a witness in other cases?
As an expert witness in other cases, all of it's, I don't count anymore. I've been doing this since essentially 2000, so the past 25 years. And I testify as an expert witness in juvenile court, probably, I'm now averaging about 20 a year. And then for criminal cases, I've probably testified as an expert witness maybe over 40 times now. For both, I've also reviewed cases for the defense, and I've done a handful for the defense, but the majority, because of my job, is I'm usually requested for assistance because of the patients that I see.
And if there were any other issues, like Mr. Strantz brought up, I'm sure he would have brought them up. Was that the only other issue regarding your testimony and all the times that you've testified that you're aware of?
Yes, and I mean, I've never not been allowed to testify as an expert.
I'm going to pass up something. Do you recognize that?
Yes.
And what is that?
This is my CV.
Okay. Just lists your work background, educational background, et cetera.
Yes.
Basically what you've already testified to.
Yes.
Your Honor, I would offer that as the next number to exhibit.
What are we up to? 4, Exhibit 4.
All right, Dr. Lakin, in your years of experience, have you worked specifically with skull fractures before?
Yes.
Okay. Now, can you describe, in any physical case that you treat or review, can you describe the process of how you determine if abuse occurred?
Yes. So just like with any type of medical condition, you have to start out with a history. So a patient comes in and you take a history as to what has happened, what are the symptoms, just like you do for any medical condition. Because I'm a pediatrician, then I have to take history from the caregivers that present with the patient. I review any medical testing that's been done up to that point, and then I may also recommend additional testing. I may be talking to other doctors that have seen, because I'm a consultant, and they've already seen the first treating physician. So I may also discuss with them any type of concerns that they have or findings that they have as I'm going in as well to see the patient for myself. And then based on any tests that I review, also if there's radiological studies, I'm going to review all the radiological studies as well. In particular, because in my field, we always have a lot of radiological studies, then I will go and speak with the radiologist and review those films with the radiologist as well. Any other subspecialists that might be involved, neurosurgeons, orthopedic surgeons, infectious disease, just whoever else is involved. And then based on all of that information, then I'm going to develop my recommendations, my assessment and recommendations.
Thank you. And then in your role as the head of the care team, could you just explain what it is the care team does exactly?
Yes, so we're a consultative service at the hospital. We are not the ones that see the children initially if they're coming in through the emergency department. So any children that come into the Vanderbilt Emergency Department that have any type of traumatic injuries that might be concerning for non-accidental trauma, but also we'll see children that have complex medical conditions where they might be presenting like with what we call failure to thrive. They don't grow well. We have a failure to thrive clinic. They will consult us to help assist if they want some additional input, because we also serve as the primary sort of liaison to communicate those medical findings to the outside agencies that might involve, such as Child Protective Services or law enforcement, because someone has to explain to them what the injuries are and everything. So that's our role. And then we do, our team has a clinic, and so children are sometimes referred to us by other pediatricians that have concerns. We may get children that are seen out in the field by Child Protective Services or law enforcement. They can refer children to us as well. And in that situation, we'll see them on an outpatient basis as the first provider that does the examination.
So when the care team gets a case, if I'm misstating this, please correct me, this has already been suspected by someone at that point. Is that accurate?
For the most part, except for those situations where we have the complex medical kids. So with complex medical kids, it's not necessarily that the question is coming up whether it's non-accidental trauma. It is because of their complex medical conditions that the families may need extra help or not growing or things like that. So that's also a portion of our practice.
Okay. And even so, some of the cases that you review, your determination would be that it's the result of an accident and not abuse. Is that accurate?
Oh, of course, yes.
And what do you base that on?
Again, we look at whether the history is going to support the type of findings that we see, the medical findings that we see. If there are other additional injuries that we find, such as occult fractures, healing fractures, or other injuries that the presenting issue that came in was not remotely associated. So then the question is where are these injuries coming from that, we didn't get a history for?
If there's other evidence outside of a description of what occurred, such as video or something, would that be important to consider as well?
Yes.
Now, are you familiar with Olivia Hyde?
Yes.
And were you asked to consult or review that case?
Yes.
Okay. Could you please describe the process and assessment you made regarding how you evaluated that case?
Yes, so I actually was not called to see Olivia when she came to our emergency department because she was actually referred from, I believe, law enforcement to have another evaluation done because of the findings that were on a video that was provided to law enforcement by the daycare center. So she was originally seen by her primary care provider, who did a physical exam shortly after the incident. I think the incident occurred January the 9th, and then she was seen by the primary care provider on the 13th. And so at that time, some external injuries were noted and documented. And I believe they checked a blood count or hematocrit just to see what her hematocrit level was, red blood cell count. But there weren't any types of studies that were done to look for any internal injuries. And so after the detective had seen the video and saw the extent, then she went to the emergency department for further, more detailed studies, x-rays and CT scans. Our team was not consulted at that time when she came to Vanderbilt because it was the video was already known and reported, and so they did those studies and then reported back to the caseworker what the findings were. And it was only after that process then I was asked to review all of that. So my evaluation included reviewing the videotapes. There were 2 videotapes, looking at all of the medical records. And I actually reviewed all of Olivia's medical records because she was only 13 months old. And so I had all of her primary care records as well as her visits to the emergency department. And then I reviewed all of her lab work that was done at our hospital, the CT scan, the skeletal survey. So,
Thank you. And can you describe your assessment that you made about Olivia's injuries in this case?
sure. So actually the first thing I was able to review were the records. And so in the emergency department records and the findings, as well as looking at the CT scan of the head and the skeletal survey, there were injuries noted on her CT scan of a area on her, just to the left of her sagittal suture of a possible fracture. The area was described as a lucency that was suspicious for fracture. She also had a small abrasion scratch towards the inner surface of her left eye. And that was noted on her physical exam in the records. She did not have any skeletal fractures. And on her physical exam, and the visit to the emergency department was not done until the 19th, so that's 10 days after the incident. And she still had documented some fading bruising that were on both of her arms in the emergency department at that time.
Thank you, ma'am. I'm going to pass forward. We're going to flesh out more of what you just testified to, but I want to do you recognize that?
Yes.
What are those?
These are the medical records for Olivia.
Okay. Are those the medical records for her visit that you described on the 19th, I believe?
Correct, yes.
Your Honor, I would ask that those be admitted as the next numbered exhibit.
Right, next exhibit in order would be 5.
If you could keep those with her, please. What's their number? And your, Doctor, if I could direct your attention to page 46, where it says findings, do you see that?
Yes.
Could you please read that?
Yes. No intracranial mass effect or midline shift, normal parenchymal attenuation, no evidence of intracranial hemorrhage or evolved infarct, no extraaxial fluid collection, normal size and configuration of the ventricles, linear lucency left of the sagittal suture, extending to the coronal suture, no overlying soft tissue or underlying intracranial abnormality, normal scalp soft tissues, opacification of the maxillary sinus, the mastoid air cells and middle ear spaces are clear, unremarkable orbital contents. The impression is no acute intracranial process. Number 2, thin linear lucency just to the left of the sagittal suture, extending to the coronal suture, suspicious for age indeterminate, though likely subacute to chronic fracture. No soft tissue swelling or intracranial abnormality is seen adjacent to this lesion.
Okay. Can you please explain that to normal people? What does that mean that
Yes.
you just read to us?
So again, the CT scan was performed to evaluate for any type of injury that you can't see externally on a child. We are always very concerned if there's a history of head trauma to make sure that there's no injury to the brain itself, intracranial hemorrhage, subdural hemorrhages, those things that we can see in abusive head trauma. There was an abnormal finding, which is this thin linear lucency that was described, that was extending from the coronal suture. The radiologist described this as suspicious for age indeterminate, though likely subacute chronic fracture. So there was an abnormal finding on the CT scan that was linear. It's described as linear, and when you see the fracture, you can tell it's very linear. It's not what we call the serpiginous or wavy. It is parallel to the sagittal suture. So in a baby's skull, you have 4 to 5 major sutures between the different bones of the skull. And this was to the left and parallel to the sagittal suture. The lucency was suspicious for fracture because fractures are linear on scans. They're not serpiginous.
Let me ask you to clarify that. The terminology that the radiologist used, suspicious for fracture,
Yes.
would he have seen the video at this point?
Oh, no.
Would that have helped him make his diagnosis of the CT scan?
Yes, so the radiologists will tell you all the time that the only thing that they have for interpretation is what is given to them when they're reading the films. And so that comes from the emergency department. And no one in the emergency department saw any video. They were just told that there was a video of a child being injured, and they needed to examine the child to see if there were any internal injuries. So the more information that can be provided, the better their interpretation is.
Thank you. And we've been talking a lot about sutures and skulls and whatnot. I'm going to pass you an item so we can let the jury understand what you're talking about a little more clearly. Do you recognize that?
Yes, this is what we call the 3D reconstruction on the CT scan of Olivia's skull.
Is that a still image of the 3D?
Yes.
Okay. Does it appear to be accurate? Has it been altered or
Oh, no.
edited in any way?
No.
Your Honor, I would offer that as the next numbered exhibit and ask to publish it to the jury.
No objection.
6.
Could you please, with the pointer there, describe what you were talking about with sutures and linear lucencies and whatnot?
You may need to step around, doctor, if it's not cooperating with you.
You can use my microphone if you'd like, so the jury can hear.
Okay, now we can see it. So I was talking about the 4 to 5 really large sutures that you have normally in a baby this age, at 13 months of age. And these are the one of the major ones, which is the coronal suture. And then this one that's going perpendicular, this is the sagittal suture. So those are supposed to be there. Those are not fractures. We know they're supposed to be there. This is the anterior fontanelle that you can see right here. And everybody knows that is the soft spot, so that's just where those bones are coming together, but it's not completely closed. And then just to the left of the sagittal suture, there is and the reason why the radiologist described it as linear is because it's very straight. There is this crack right here, and it goes from the coronal suture, but it's parallel to the sagittal suture, and it's very linear. Oh no, is there a way to blow that out?
They're saying, sorry, laser pointer is not showing up very well. I'm gonna come up here.
We got a yardstick. Let's get, modern technology fails us all the time, so we'll resort to the old school methods.
Please.
Okay. This is the coronal suture. So again, those 4 to 5 very large sutures that you see in babies. Excuse me. This is the sagittal suture. This is the coronal suture. This is the anterior fontanelle, or the baby's soft spot. And then you can see how squiggly these are and how squiggly these are. And that's the characteristics of these normally occurring sutures. This is a very linear, which is why it's described as linear or crack. It reaches here to the coronal suture. It doesn't terminate anywhere else. That's the end of it. And that's the area that the radiologist described as the linear lucency that was suspicious for fracture.
Thank you. And if you could just stay there, because I'm going to next play the actual 3D rendering, so you can identify that as well. And is this basically the actual 3D image of the still that we just looked at? Is that what this is? Dr. Lakin?
Yes.
That I'm getting ready to pull up?
Yes.
Do you recognize that from the records that you reviewed?
Yes, I think. Yes.
Your Honor, I would like to offer this as the next numbered exhibit, the actual 3D image of the CT scan.
Is it going to be on a thumb drive?
Yes. So is that basically the same thing that we were
Same one.
looking?
Yes,
Okay.
right here.
Now, you can sit down, I'm sorry.
Okay.
Thank you so much. So while you were reviewing the CT scan, here's the thumb drive, by the way. For the clerk to mark. Did you consider any other possibilities for that linear lucency? Is there anything else that it could have been?
Yes, so we sometimes will see what we call accessory sutures that can be found on the skull as well. The accessory sutures, again, we describe them as sutures. They're just normal variants that you can sometimes see. And that would be a very unusual location because they're typically seen on the parietal or the occipital bone. And
I'm sorry, I'm going to pull that so you can show us what the parietal bone is where.
so that's in the bigger flat surface on either side. And the occiput or the occipital bone is in the back. And you have the lambdoid suture, which is the sutures that join the parietal bones and the occipital bone. That is the area where we typically will see the accessory sutures.
So is this line that we were talking about that you pointed out, is that in a normal area that you would see an accessory suture?
It's not the typical one. And we also will more often than not see what we call bilateral, so on either side, as opposed to just one isolated.
So other than that, what else differentiates that from either what you would call a, quote, Wormian bone or accessory suture? What differentiates what you're seeing there from a Wormian bone?
So a Wormian bone is actually what we call an intrasutural accessory bone. So it will oftentimes be within the suture itself, and they look like bone fragments, as opposed to an accessory suture, which is, again, it's not connecting. That's why accessory sutures can sometimes be mistaken for fractures. Wormian bones they look like fragments of bones. And Wormian bones are considered also can be associated with other medical conditions, such as probably the most common one people hear about are bone conditions called osteogenesis imperfecta. But Wormian bones can also be seen in just the normal general pediatric population. This is, again, not a typical area where you would see a Wormian bone. It would be incredibly unusual to see one at the coronal and the sagittal, where the coronal and the sagittal come together. The other distinction that I made, and the radiologist that reviewed this, Dr. Martin, with me, that linear appearance, again, is very straight and not irregular. So that also is not characteristic of a Wormian bone. Also, there is no continuation of that crack with the sagittal suture. So it's parallel to it. And then it does reach where the coronal suture is, which that's what we typically see with fractures. It's that weak area where it comes together with the suture itself. So a Wormian bone, again, looks more like a bone fragment and has a continuation. When you do 3D reconstruction, you oftentimes get what we call noise around on the, what looks like the surface of the bone. So you can see little wavy areas on the bone, but the actual findings are very clear in terms of, you can see the very clear sutures and you can see the very clear crack.
Thank you. We've been talking a lot about wormian bones and accessory sutures. Did you, as part of your preparation for your testimony today, did you prepare some examples of wormian bones?
Yes,
Did you provide those to me earlier today?
yes,
Is that what we're looking at here? Is this the images that you prepared for us?
yes.
Could you please describe what we're looking at here? This is not, this, to be clear, this is not Olivia's.
No, these were just the examples when I was explaining to Mr. Holder the differences between wormian bones and sutures and fractures. So this is just, again, a 3D reconstruction of a baby's skull, which shows the sutures, and it just outlines the different sutures that I just described as well. So the lambdoid suture is where the parietal bones and the occipital bone come together, and then the posterior fontanelle, or the soft spot in the back, and then that's a picture of the sagittal suture.
And I apologize, but I'm going to ask you to get up again so that we can.
So as I just mentioned before, this is the parietal bone on either side. The sagittal suture separates those two. This is the lambdoid suture, which separates the parietal bone from the occipital bone. And of course, it's also on this side. That noise that I was talking about that sometimes happens with 3D reconstruction is not, these are, you can see like these little spots here. You can even see a fairly prominent one here. Again, this is a computerized 3D reconstruction, so when the computer is developing these, you can sometimes get some background noise.
I'm going to go on to the next slide. If you could please describe what's in the next slide.
So this is an example of a true wormian bone, and you can see how it looks like a fragment as opposed to anything that's parallel or linear, and it has very squiggly outline, just like the sutures do. And then again, the sagittal suture is right here, but these are called wormian bones.
Is this, and again, this is not Olivia's skull. Is this?
No, this is not.
Is this, I'm sorry, is this from the front or the back?
This is the back.
the
This
back.
is the occipital bone,
Okay.
and this is the parietal bones.
Gotcha. I'm going to go to the next slide. What are we looking at here?
So this is the only wormian bone representation I could find in my literature search to show an actual one that was associated with the coronal suture and the anterior. This would have been where the anterior fontanelle was, but there was a wormian bone, or what they call an intrasutural bone, that was present. And it's right here. And again, as you can see, this is not parallel to the sagittal suture. It is a fragment. It looks like a bone fragment. So it's not linear.
Thank you, Doctor. And then the last slide is, again, this is Olivia's image.
Right, this is the same image that we showed before. Yes. So here's her anterior fontanelle, and here is the very linear crack.
Okay, thank you. And as you're taking your seat, I'll ask you, my understanding is that this fracture did not show up on a normal x-ray. Is that accurate? And is that normal for?
Yes.
Is that why you do a 3D image?
Correct, or CT scan. If you think about it, the regular plain films or x-rays are just two-dimensional, but the CT scan is three-dimensional. It goes all the way around and formulates those images.
So just to reiterate, what is your expert opinion as to what Olivia, that linear lucency, what is that we're looking at?
In my opinion, it's a fracture.
Now, when you were reviewing Olivia's records, I know you said you reviewed photos and videos, is that right?
That's correct.
And did you review those again this morning?
I did.
I'm going to play the first clip that, we watched the entire video yesterday. We're not going to do that. I'm going to play just a clip of, while Olivia was in the high chair, that we just zoomed in a little bit so that you can see. Do you recall that video?
Yes.
Okay. Now, what you saw there in your expert opinion as an expert in child abuse pediatrics, is that consistent with some bruising that you would have seen on her arms?
Yes. And may have seen some in her abdomen if she'd been seen earlier, but.
I'm gonna just let this play out. It's only got 30 seconds left or so, 40 seconds. Okay. And you said you previously saw the bruised photographs as well, correct?
Yes.
I'm gonna pull those up again. So based upon that video and then these photographs, what are we seeing here in these photographs?
So you can see those oval-shaped bruises that are, I think there's 3 down towards the bottom, and then a little bit, it's more linear up at the top. And so those would not obviously be in an area that she would normally fall, like what I call childhood bruises, or typically more anterior where they're walking and they fall forward. These are actually what we call multiplanar because they're in the back, but they also circle around. And that would be consistent with where she was grabbed and shoved into the chair.
I'm gonna have 6 photos. I'm gonna move along and just, if you could just describe the bruising.
Yeah, again, you can see that those oval, a few of the oval and then linear areas up at the top. And again, that wrap around her arm.
And the next one, is that similar?
That's the same one, yeah.
And that's on the back of her arm, is it?
Correct.
Okay. And then this one, it's like you can see some sort of waffle pattern on there.
Yes.
What would that be from?
It's something patterned, so anytime we see a pattern injury, then we are very concerned about inflicted injury. So I believe like around that area, she had some sleeves, and the fabric on it may have been pushed into it.
Okay, doctor, so after you reviewed the video and you reviewed these photographs, what determination would you make as to what sort of, was this accidental trauma, or what would you classify this as?
No, this was non-accidental trauma or inflicted trauma. And it's consistent with blunt force trauma.
Thank you. I'm going to show another clip now that we watched yesterday. Again, it's just zoomed in and edited for time purposes. This is of the nap time. Do you recall watching the nap time segment as well?
Yes.
Normal for a 1-year-old to push themselves up and not go right to sleep like that?
Yes.
I'm going to pause it there for a second. Could you please describe what you saw in that 45-second clip there?
Yeah, so Olivia is being forced down on that little cot multiple times. I think I counted 8 times where she was pushed down into that cot. And she's crying. She was upset.
Was she being grabbed by the arms at some point too as well?
Yeah, and then also, pulled out by her midsection. I couldn't tell whether it was the midsection or her legs when she pulls her all the way down to the bottom, and then her head strikes the cot.
And if I could, behind you, we have it's been admitted earlier as, I believe, Exhibit 3, I believe. So it's not the exact cot, but it's the exact type of cot from the daycare.
Yeah.
Is that, if you could just please look at that. Have you had a chance to see it before?
Not this particular one, but yes,
Okay.
I've seen cots like this before with my
Okay.
kids.
And after you reviewed this video and now that you see the cot and you reviewed the CT 3D image, what is your opinion as to how that injury was sustained?
Yeah, so after reviewing the video, and if you watch the towards the very end, which appeared to be, you can't see how on a video exactly how much force is being used, but you can see probably what appears to be the most forceful time when she's pushed down. And that cot has rigid edges, metal here, hard plastic here. I'm sorry, hard plastic through here. This is mesh. If you watch the very last time, which I think I counted, it was the 8th time when she was forced down.
I'll rewind it.
Yeah, the very last time. It was very forceful. And you can see that move a little bit, the covering on it. And I believe she hit her head, the top of her head, right here on this hard plastic when that happened. The other thing that was notable to me is she's 13 months old. You can't force a 13-month-old to take a nap. You can't force them to be still. They're gonna eventually fall asleep. But after that last incident, she doesn't move at all.
What is your opinion about that?
I was very concerned that she had a concussion when that happened. Because through that whole couple of minutes, she's crying, she's popping back up because she doesn't want to take a nap. She's pushed down, she gets back up. She's pushed down, she gets back up. She pushed down, she gets back up about 7 times. And on the very last one, I was very concerned that that fracture occurred from the top of her head striking up here on this hard plastic, and she doesn't move after that.
We watched that yesterday. It was approximately 35 minutes that she didn't move. What would that tell you as a doctor?
I'd be very concerned that when she struck her head that last time, that caused a concussion, that she went unconscious.
Now, in the medical records, I believe they noted there was no soft tissue swelling.
Correct.
Would that be, could you please tell the jury, would that be normal for someone that was seen 10 days later?
Yes, it most definitely can
Could you
be.
just explain why that is?
Yeah. So the swelling is not necessarily going to be permanent. You may see the swelling come up, a few hours after the event, sometimes even sooner. But the swelling is not necessarily going to last for, almost 2 weeks. It can go down very quickly in a few days.
And if the child has hair and the parents had no reason to suspect head injury,
Correct.
they might not have even noticed it. Is that right?
Correct. And if you notice, she has her hair pulled up, a lot of hair up here into a little ponytail, which is would have been where the impact was anyway, so.
Could or would the repeated 7 or 8 times that she was forced down and hit her head, could that have played a role in sustaining the skull fracture?
Possibly, yeah.
Now, doctor, have you written any articles or anything related to head trauma in children?
Yes,
Could you please describe what those are and tell us if they were published or not?
yes. The most recent publication, I was involved in a research project at Le Bonheur with using artificial intelligence to detect retinal hemorrhages in infants with abusive head trauma. And that was published in JAMA, or the Journal of the American Medical Association. And then I was involved in a project involving witness cases of abusive head trauma, where we had children that came in with findings of abusive head trauma that were actually witnessed by the mechanism was witnessed by objective observers. And then I've written a chapter for an orthopedic textbook for residents and medical students, and also primary care providers that want some extra support. And the chapter that I wrote was specifically on fractures.
Doctor, did you prepare a report regarding Olivia's case?
I did.
I'm going to pass. Is that the report that you prepared?
Yes.
Your Honor, I would ask to admit that and offer that, mark that as the next numbered exhibit.
8. Good. You wanting that demonstrated to the jury before?
No, just that they can take it back with them later during deliberations, Your Honor. That's fine. I believe everything in it we've already covered through Dr. Lakin's testimony. So, Doctor, just to wrap up here, is the bruising that we see on Olivia's arms consistent with?
Yes.
Okay. And that's based upon what?
The pattern of injury that's seen, and also the support in seeing the mechanism on the video.
Okay. And is the skull fracture that we saw and that Olivia sustained, is that consistent with?
Yes.
Based upon?
Also, the mechanism that was viewed on the video, as well as the characteristics of the injury that is seen on the CT scan.
And Dr. Lakin, as an expert in pediatrics, after reviewing all the evidence in this case, what are you able to say about the injury sustained by Miss Olivia Hyde?
The injuries that I reviewed, in my opinion, are consistent with non-accidental trauma or blunt force trauma.
If I could have one moment, please. Your Honor.
You may.
So, Doctor, let me just ask you this. Was this the only CT scan that was done on Miss Olivia Hyde that you're aware of?
Yes.
So why would they have not done a follow-up CT scan to determine if that was a fracture, if it had healed or not? Is there a reason they wouldn't have done another one?
Yeah, we don't follow up linear fractures. There's no treatment for them, and you're not going to expose children to additional radiation if there's no intervention involved.
So it might have helped us in our legal case, but it has no medical necessity for the child.
No.
Correct.
So all of our evaluations are directed towards medical treatment, not for court.
Thank you very much, Doctor. I have no further questions at this time.
Ladies and gentlemen, anybody, we've been going for a while before cross-examination. Anyone need a break? What, Mr. Tryon, you're
Thank you.
free to cross-examine. Oh, sorry, did somebody raise a hand I didn't see? Got to be more aggressive. Throw something at me next time. All right, we'll take about let's take a 10-minute restroom break and then we'll come back. We'll stand at recess for 10 minutes, come out, so. All right, ladies and gentlemen, we're now ready for cross-examination. Mr. Stryans, you may
Thank you, Your Honor.
cross-examine.
The event that we're here about occurred on January the 9th, 2023, is that right?
That's correct.
And you may not be aware of this, the indictment in this case was returned April the 4th of 2023. Your report was disclosed, I think, February 24th, is that right?
That's correct.
Of 2023. When did you actually do your work on this case?
So I was first contacted in February of 2023. Actually, if I can look back at my
Sure.
notes, because I wrote down my first contact was let's see. Yeah, February 14th of 2023, I had a request to review the records. And then I wasn't able to see the video until March 7th of 2023.
After seeing the video, did you communicate with the district attorney's office about the charges to be included in the indictment?
We didn't talk about I don't think we talked about the charges. He asked me about my opinion about whether or not I felt like this was consistent with non-accidental trauma, and then also we discussed the fracture.
Now, Olivia Hyde was seen, I think you told the jury, by her primary care provider. That would have been January the 13th, is that right?
That's correct.
And she was presented that day for some blood work and a physical exam.
Correct.
And you've had a chance to take a look at what the Vanderbilt Pediatric Office in Hopkinsville, Kentucky concluded about that visit, is that right?
That's correct.
And that was just several days after the alleged event,
Correct.
correct? They reported that there were no changes in her eyes or pupils, correct?
Correct.
And that would have been significant to your sort of alternate diagnosis of this, perhaps there was a concussion or something like that.
You're not going to have changes in your eyes with the concussion.
They reported a painless range of motion in her extremities, correct?
Correct.
That she did not appear to be in any distress
Correct.
whatsoever. And that all of her lab results were normal.
Correct. They only took one lab test, and that was the hematocrit.
And they didn't note anywhere that there was any swelling of her head, is that right?
That's correct.
And they didn't note that there was any tenderness reported by the parents in her head.
Not in her head. The parents reported irritability since the incident.
In fact, there was no swelling of Olivia's head that was ever reported
Correct.
or detected in this case. Is that right?
That's correct.
On January the 18th of 2023, that was the date that the police suggested that the Hydes bring Olivia to Vanderbilt. She was not sick, correct?
Correct.
She was not unconscious.
Correct.
She was not in pain.
I'm not aware of that, no.
Wouldn't you have expected signs of pain, evidence of crying in a child that had actually sustained a skull fracture?
Not 10 days after the event. And the other thing that I think is lost a lot of times is that we're talking about a 13-month-old who's non-communicative. And so children of that age, it's actually very common that we talk about the fact that we can't base our clinical findings on these children, which is why we do so many x-rays and we do CT scans, because they can't tell you that their head hurts, they can't tell you that they don't feel well. So their changes in demeanor are oftentimes missed because 13-month-olds get fussy and 13-month-olds cry, but they can't tell you why. And so I'm not surprised at all that there's no history of that, because a 13-month-old will cry intermittently. A 13-month-old, they get picky. So a lack of appetite, you don't even think twice about because they're 13 months old. The other issue is my specialty is pediatrics, and we do try to do a lot of education with other providers. So Olivia, having the history that she had in the report, obviously the primary care provider never saw the video. If the primary care provider had seen the video, I'm sure that she would have transferred her to an ER to be evaluated. But she didn't have any of that history. She didn't have that. But the reason why we're called is oftentimes because we tell a generalist, these are the things you have to do, because 13 months old, you can't base it on seeing if she's tender in her arms and legs. You don't know. So sometimes those things are, I don't want to say that they're missed, but if that's not her routine practice to examine the head, to palpate the head, especially if her hair is in a ponytail on the top of her head, she may miss it. I can't speak to that. I'm not going to say that she did. I'm just going to say what she has documented I can't speak to. But that's why we have my specialty.
And you talked about Olivia being nonverbal because of her age. For children that are nonverbal, doesn't that also complicate your sort of alternative suspicion that there might have been a concussion?
So I'm basing my concern that there may have been a concussion on my experience with infants and toddlers and my observation of what happened. When you are trying to, again, you can't force an infant or a toddler to go to sleep. They have a very characteristic way of falling asleep. She was crying and trying to get up. She's pushed down onto the cot very hard, and then she goes still or limp and doesn't move again. That's not the characteristic of a 13-month-old falling asleep.
I want to talk to you a little bit about the CT scan that was done at Monroe Carroll Hospital at Vanderbilt on January the 19th, 2023. And the finding of the radiologist was that there was a linear lucency in the skull that was suspicious for fracture. Is that right?
That's correct. They're not going to report that.
Right, but I assume she would have been examined by someone before the CT scan. Is that right?
She was in the emergency department, and I believe they documented fading bruises.
Okay, in her arms, correct?
Correct.
But not in her head.
No.
And by this point in time on the 19th, we're 10 days removed from the incident. Is that right?
That's correct.
And Mr. and Mrs. Hyde did not report any bruising or tenderness to Olivia's head when they were bathing her over that 10-day period.
That's correct.
do you know if anybody at Monroe Carroll palpated her head before they did the CT scan?
I do not.
Would that be something that you might have done to see if she was reactive to any sort of pain?
Probably.
Did you see anywhere in the records where the parents, Mr. and Mrs. Hyde, reported any sort of decreased appetite by Olivia?
No, the only symptom that I came across was increased irritability and increased crying after the event.
And without getting too graphic, no, the parents never reported any abnormal bowel movements, anything like that?
No.
Never reported any lethargy where she was sleepy or tired, anything like that?
I don't recall specifically. The note from the primary care provider is the one which was on the 13th, is the one that she was described as being, again, clingier and more irritable than usual.
But things like decreased appetite, abnormal bowel movements, lethargy, those are things that you might view as telltale signs of some sort of a head injury, correct?
So they are, and depending on how severe it is, it depends on how long it's going to last. So I don't recall what time the event occurred, but the family was not aware, no one was aware that anything had happened until the video was reviewed. So depending on what time, the timing of that video, which I want to say was probably around noontime, and then if mom didn't pick her up until the usual, after work around 4 or 5, we basically have 5 hours that are not accounted for. So I don't know what her symptoms were during that period of time. No one knows what the symptoms are during that period of time. So if she had lethargy or increased sleepiness, or if she vomited, or if she had a change in her bowel movements, no one knows, because there's about 4 hours that the parents weren't taking care of her, so they can't give a history what happened during that 4 hours.
One of your alternate diagnoses in this case is, I think you phrase it as probable concussion, is that right?
That's correct.
You're not telling the jury that you're making a finding as an expert that this child had a concussion, are you?
I'm saying that what I see on the videotape makes me very suspicious that after her head struck the cot and she goes completely limp, that in my opinion, that would be highly suspicious for a concussion.
And you are suspicious of it, just like the radiology department was suspicious of that linear lucency, correct?
So I would hesitate giving a diagnosis even if I had physically examined her, because she's an infant. But by seeing the video, I feel like the video would support that it's more likely that she did have so a definition of a concussion is a change in the neurological symptoms with no radiological evidence. So you've got basically your brain can't communicate because of the injury. And we don't have, like, with a intracranial hemorrhage where you see something on the CT scan, they wouldn't be diagnosed with a concussion, they'd be diagnosed with an intracranial hemorrhage because there's something abnormal on the CT scan. This child on video has, to me, a very distinct change in her neurological behavior once her head strikes the cot. And she stays asleep, which is lethargy
But as
or
you sit there
increased
right now,
sleepiness.
you don't know if she naturally fell asleep or has this probable concussion. Is
In
that
my
right?
opinion, it's not naturally falling asleep.
Okay.
So
But it's also, you're not able to tell the jury that it's a concussion either.
I am saying that I am very concerned that what I see in the video is representative of a concussion. Yes.
So she's nonverbal, she can't tell her parents that she has a headache, which
No.
would be consistent with a concussion, correct?
She can't tell her parents anything. She's
Right.
only 13 months old.
That's my point.
Right.
And the point I'm making is none of the symptoms that are attendant to a concussion, nausea, vomiting, just basically not acting normal, are not part of this case, correct?
So those are not present in all concussions. And you can see that on Sunday afternoon when football players are taken out for concussion protocol. They're not on they don't have all of the symptoms. But the symptoms that she did have is she had an immediate change in her neurological status after she struck her head.
You're not saying that all of these symptoms are manifested immediately by someone who sustains a concussion?
They are more often going to happen temporally related to the incident, but yes, they can be delayed depending on the severity.
Don't you think it's significant that two young parents that are dealing with their child, who was their only child at that point in time, if she had any of these sorts of symptoms, they would have known? For example, not eating, incessant crying, irritability, falling asleep, arousing, and then falling back asleep. They would have notified somebody about those symptoms, correct?
So again, those symptoms are only as good as the interpretation by the caregiver, and if the
No,
child,
I'm not talking about an interpretation. I'm talking about the mere reporting by the parents of the symptoms, not any evaluation of the symptoms.
no, but I'm talking about the interpretation by the parents of the symptoms is very difficult in
There are no
infants.
symptoms is the point I'm making.
What I'm saying is there could be symptoms that are misinterpreted by the caregivers as normal behavior of a 13-month-old.
How would-
That is
how would the
why,
parent-
that
how
is
would the
why
parent-
concussions are so
Whatever
difficult.
talking, please let her finish her answer before we begin answering the next question. A court reporter has to take down everything that's being said, so when you're both talking at the same time, it makes her job extremely difficult. So wait for her to finish her answer.
Judge,
before
the
we-
problem is, very respectfully, she never wants to finish. And
Pardon?
She doesn't seem to want to finish. That's why I feel like I have to
Well,
try to interrupt her, and I apologize for that.
then you can object to her not being responsive to your question, but at this point, when you simply start talking over her, it is not productive for the court reporter or for the jury in my opinion.
The point that I'm making is, if she was not eating, the parents would have seen that.
And the point I'm trying to make is that in a 13-month-old, your definition or their definition of not eating is variable. So again, what can be interpreted as symptoms of concussion can also be interpreted as a 13-month-old.
The parents would have seen and reported incessant crying, is that right?
If it was incessant crying,
Right. And that would be a symptom of a concussion.
it can be, but it can also be a symptom of a 13-month-old.
And incessant irritability, the same thing. They would have noted it and reported it.
They did report irritability.
Not incessant irritability,
What's your definition of incessant?
all the time.
Increased. She said increased.
Falling asleep, arousing, falling asleep again, never reported, correct?
Again, it's a 13-month-old.
Okay.
That's the problem that we all have. Physicians don't always make diagnoses in infants, which again is why we do so many scans, because we can't gauge that based on normal infant behavior.
You, in your testimony, you told us you prepared your report. I think it was it in February of
Yes.
25?
February 24th of 2025.
23, forgive me.
No, it was 2025.
Yes, 2025, forgive me. Today in court, here in open court for the first time, you said that there was perhaps abdominal bruising. Is that right?
I said when they were showing me the video of her being pushed up against the table that there were bruises on the arms, and there could have been bruising on the abdomen, but I don't know who examined her on that day, because she didn't go in for medical care until the 13th.
And you did your report after having the benefit of seeing the video, is that right?
Of course, yeah, that's included in all of the information I reviewed.
And you made no mention of the possibility of abdominal bruising, is that right?
Nobody documented abdominal bruising, No.
That, I guess, again, that's my point. You're just sort of saying things today that were never documented in your report.
No, I was asked about the bruising on her arms and if what I saw was consistent with what I, on the video, and could that support that? And I said, yes. And there could have also been some on the abdomen, but there was not documented.
And the only point I'm making is in your written report that you did in February of 2025, you make no mention of the possibility of abdominal bruising. But it's something that you sprinkled into your testimony this morning, correct?
Correct.
Towards the end of your testimony, you talked about the wormian bone
Yes.
and your experience with your view of what a wormian bone should be and where it should be. Is that right?
Well, it's not just my view. The literature supports where the wormy bones typically occur.
Do you hold out the possibility that other experts in your field might have had different experience with wormian bones?
So I'm not talking about the experience, my experience with wormian bones, but I have to have a really good understanding of wormian bones, particularly because they're associated with osteogenesis imperfecta. So I've diagnosed quite a few children with osteogenesis imperfecta that had wormian bones on their scans. It's not my opinion about the location of where wormian bones are reported. That's not an opinion. That's a fact. It's an opinion as to whether or not what is represented in the CT scan is a wormian bone, and the radiologist at Vanderbilt did not feel like it was a wormian bone. In my opinion, it's not a wormian bone. But I agree, there may be other experts that have a different opinion than I do.
And the radiologist at Vanderbilt said it was a linear lucency suspicious of fracture.
Correct.
May I have one moment, Your Honor?
You may.
Those are my questions. Thank you.
Redirect by the state.
Briefly, Your Honor. I want to start, first off, with basically the last thing you said, because I don't remember exactly what you said. What was
Osteogenesis imperfecta.
Could you please explain to me and the jury and everyone else what that is?
Yeah, osteogenesis imperfecta is a genetic condition where there is a defect or a mutation in the genes that code for collagen. So that can cause bone problems. They kind of call it fragile bones.
And I think we talked, Mr. Striance asked you a little bit about the medical report and noted there was no hemorrhaging or brain swelling. Can there be skull fractures without brain swelling and hemorrhaging?
Or soft tissue swelling, not brain swelling, but the soft tissue swelling.
Yes.
Yes, we had. So again, the problem goes into the timing of the examination and the examination itself. So it's just a fact that documentation may not be the greatest and the exams may not be as detailed, depending on who's examining the child. But certainly when you have swelling that's associated with a fracture, it can dissipate very quickly in just a few days. It depends on the amount of injury that's there. Yeah.
And I feel like we've kind of danced around this both on my direct questioning and Mr. Striance's cross. In your opinion, was Olivia knocked unconscious by that final slam?
In my opinion, yes.
And lastly, have you received any extra pay for today, or is this part of your normal job?
No. None.
This is part of your job?
Yes, it is.
Thank you, ma'am.
Yeah.
Mr. Dryans, any questions?
There you go.
Thank you, doctor. You may step down. Are you retaining the doctor as a witness for possible recall? Okay. Doctor, you just check with the district attorney's office about how to get in touch with you. All right. State, having your next witness?
Yes, sir, I'm calling Agent McGowan.
Agent McGowan, if you'll come up, please. You may. address, and wasn't anything that I needed to trot you across the hallway for, so we're going to go ahead and proceed. So the state may call your next witness.
Alan? Sir, would you please tell us your name and spell your first and last name for the court reporter?
Okay, Jonathan McGowan, that's JONATHAN, MCGOWEN,
By whom are you employed?
Tennessee Bureau of Investigation,
How long have you been with the TBI?
for 6 years now.
All right, and how long have you been in law enforcement altogether?
I think this is my 13th year.
All right, and where were you before you were at the TBI?
Prior to being at the TBI, I was a detective with the Metro Nashville Police Department, where I served there for, I believe, a total of 7.5 years.
Okay, which is where we would have first met, correct?
Correct, correct.
And pursuant to your duties with the Tennessee Bureau of Investigation, were you assigned as the case agent or lead agent in the incident that we've been here these last 2 days or day and a half?
I was.
And do you recall when you were assigned this case?
It would have been January the 19th is when, on that day, my supervisor called me and asked me to lead this investigation.
Okay. And for sure, having the right to be in the courtroom, you heard from Detective Naris and other gentlemen about how that came about.
Correct.
Is that correct?
Yes.
What they said?
Yes.
And when you were assigned the case and the TBI took it over, did you gather the evidence in the case, the video, anything that we've seen here today? Was that part of your case file?
Yes, as part of conducting an independent investigation, I took the materials that was gathered from the DCS caseworker and the detective. Those were added into my case file, but I also conducted my own investigation.
Okay. And by that, your own investigation, that involved like speaking to Mr. and Mrs. Hyde
Correct.
and obtaining, as I said, the video evidence?
Yes, I obtained the video as well.
Did you also perhaps obtain medical records and any other documents that might be consistent with your investigation?
Yes, as part of my investigation, I collected records from the daycare center, multiple medical facilities. I wanted to make sure we had all the evidence that would be necessary.
And did that include what turned out to be, I believe, Exhibit 1, that day bed or child bed? Exhibit 2.
Yes, I did. I collected the blue sleeping cot from the daycare center.
Okay, that's what I was going to ask is, did you have to go out and buy that, or was that one that was at the daycare?
No, I made contact with the daycare center director and asked to have select one of the cots so that the jury could see that today.
Okay. And was this just like any of the other cots in the toddler room?
Correct.
Okay. And I take it you're the one that packaged it up and
I was.
preserved it and brought it to court, is that right?
That's correct.
Back in just a moment, Your Honor.
You may.
My question.
Brian, do you have any question?
Yes, Your Honor, just one moment. Evidence at the Tylertown Daycare Center, correct?
Correct.
Do you remember an incident where there was a letter that was written by Sarah Fuson?
Your Honor,
Ladies and gentlemen, step across the way, please.
lodge my objection, which is we had a discussion about anything, statement, or anything from the defendant that's not admissible as a state unless it is admitted by the party opponent, and about a letter would be hearsay, first of all, and inadmissible unless admitted by the state. I object.
It does seem to me, Mr. Strines, that this is pretty much what we were talking about in our out of the jury's hearing conference. What exactly is that you're asking him, and what exactly are you trying to introduce?
Judge, I have no intent to introduce anything. I just want to ask him, did he retrieve a letter that Sarah had written from the dumpster at Tylertown Learning Center, where Ms. Carter had obviously thrown the letter away? Not getting into the content of the letter. I'm just asking what he did.
What relevance does it have if the content of the letter is not being admitted? How does it make anything about this case more true or less true, which is what the relevant standard is? So how would the fact that he retrieved the letter have anything to do with it?
Just thought it was significant that she received a letter of apologizing for the whole,
This is a letter written by your client?
by my client, not apologizing for any of her conduct, but apologizing that, the Learning Center had to go through all of this.
Well, but again, that seems to me to be directly on point with what Mr. Moore is saying, is that the only reason the letter would be significant or be relevant is that it contains some sort of an apology by your client. And that is the direct objection that the state has, not speaking for the state, but I think that what I'm understanding is that their objection is that if you bring in the fact that there was a letter that was written by your client to the Taylortown to the daycare, then the only relevance it would have would be to introduce what was in the letter. And otherwise, it's not relevant.
I thought it was significant that she threw it away and that he retrieved it from the
I
dumpster.
sustain the objection because I think it does fit within the exclusion of any sort of statement by a defendant that's being introduced by someone that was not introduced by the party opponent. So I think the rule would exclude it. So we'll bring the jury back. And I'm just going to simply tell them that I'm sustaining the state's objection to the question. All right. Ladies and gentlemen, in your absence, I sustain the state's objection to the last question that was answered. I would remind you, according to my instructions and everything else, that if I sustain an objection, I'm doing it basically on legal basis. It doesn't have anything to do with, I don't have an opinion one way or the other about the guilt or innocence, and you should not infer from my ruling that I hold any opinion. I'm simply applying what I believe the correct interpretation of the law is. So I sustain the state's objection, and that question will not be allowed. Mr. Strines, do you have any other
I
questions?
just had one other very brief.
All right.
Asked about certain items that you seized is probably too strong of a word from Tylertown, and one of those items was the cot that's behind the circuit court clerk right now. And he doesn't need to see it. I just had some questions for him. In one of your reports, it's investigative report number 8, you give the dimensions of that cot. Is that right?
Yes,
And just very briefly, you described it as 4 3/4 inches tall, correct? You need to look at this to refresh your recollection.
if I could.
May I approach
You may.
Special Agent Gallo? And for the record, what is it that you're using to refresh your recollection?
This is a TBI investigative report number 8, which is the crime scene investigation report.
And if you would read that paragraph that deals with the cot to yourself, and then tell us if that refreshes your recollection.
Yes,
Thank you. So the height of the cot, and that's my word, is 4 3/4 inches.
correct.
So almost 5 inches off of the ground, is that right?
That's how I measured it at the time.
And then the other dimensions are not as important to me, but this is about 5 inches off the ground, correct?
Correct.
Those are my questions.
Redirect.
No, Your Honor.
Ladies and gentlemen, if you'll step back across the hallway for a moment, please. The reason I know you said that was your last witness, and before he was excused from the stand, and I wanted to address one issue. I've been handed another question by the jury. This one is, did the skull fracture show any signs of healing? I don't know that this witness can give any opinion about that, and obviously the doctor, Dr. Lakin can come back to the stand if you choose to do so, but I am of the opinion that it was not submitted to me while the appropriate witness was on the stand. So I'm telling you what the question was. Before you close your proof, leave it up to you whether or not you wish to recall any witnesses.
So this witness.
And I'm going to tell them that. So when it comes back, I'm going to tell them that this witness would not be able to render that type of an opinion. All right, then we're going to, go ahead.
Can I be heard on that?
Yes, you may.
I mean, her opinion basically is repeating what the radiologist at Vanderbilt said, which is there's a suspicion of a fracture. So I don't know how she could ever be qualified at this point to say it was healing, because the fact of the fracture is very much in doubt, at least in my view of the case. So
I think that again would go to the weight to be assigned to her opinion rather than the admissibility of it. She's been qualified as an expert, and my opinion is that she can testify about whether or not, based on her observation of the CT scan and what she's shown us today, whether that she observed any signs of healing.
Judge, you have tried many, many cases as a lawyer and presided over many, many as a judge. If we get into testimony about something healing, then it's a fait accompli that there was a fracture. If we're going to get to the end of the discussion about healing, that's going to cement in the jury's mind, well, I guess everybody agrees there was a fracture. I think she's going to say whatever she wants to say, and
Agent McGowan, step down. Outside the presence of the jury, I'm going to allow the state to recall Dr. Lakin. We'll let him ask that question outside the presence of the jury, obtain her response, and then you can, hear what her response is, and I'll renew your objection. I'll consider your objection again at that point. We're doing it outside the presence of the jury to allow us to determine whether or not her answer would be admissible or not. So.
Judge, I think it's a wonderful thing that the court does, permitting jurors to ask questions and trying to accommodate.
It is sometimes, and sometimes it isn't. So.
And this is one of those times it isn't, because it's as plain as the nose on my face. If we start talking about healing, then the jury's going to say, more than just one juror at that point is going to say, well, gee, we're beyond whether this was really a fracture, really an injury. We're talking about healing now. And it has the imprimatur of the court now by asking the question.
I'm going to allow the state to call her as a witness outside the presence of the jury. I understand your objection. I'm going to hear what she has to say, and then I'll make a determination whether or not to allow it. Your objection's noted on here as to whether or not this procedure should even be allowed. But at this point, the jury is not going to hear anything until I have heard what the doctor says and consider how it's going to be presented in such a way as to perhaps satisfy your objections to it as well as satisfy the jury's inquiry.
Yes, sir.
All right. Dr. Lakin, if you'll come back.
Your Honor, if I could please see the question so I can ask it exactly as it's written.
Yeah, let's do it. Now, keep in mind that Mr. Strines his objection is to the fact that question presupposes the fact that there was a skull fracture, and I think that is the issue that he's objecting to. Asking the question seems to put the court's approval on the fact that there was or was not, even though the jury is clearly instructed that this question would be answered, would be asked, rather, only because somebody on the jury is asking it. But the
Your Honor.
question that is being asked needs to be, and I've advised them in my initial instructions that I may alter the question or the form of the question, so I'm instructing you, you need to ask this question in such a way that it does not automatically assume there was a skull fracture.
Yes, Your Honor, you answered my question for me. Dr. Lakin, in the medical report, the radiologist on number 2, he says, suspicious for age indeterminate, though likely subacute to chronic fracture. in this terminology, does it mention anything about, does it show anything, or do fractures show signs of healing in any way? Could you explain that?
Yes, so skull fractures are very difficult to age because they don't show the classic signs of healing that we typically see with long bones. One of the reasons why he actually, or in my experience, radiologists actually use the term suspicious, suspicious because they use the presence of soft tissue swelling to help with timing, which obviously that's the conversation we've been having all day about not lack of soft tissue swelling. So I think the best way for me to answer this is that the radiologist reported that if there is a skull fracture, it is age indeterminate because we can't give a hard date on fractures. They eventually do show some calcification, which then they would say, is healing, but.
So did this linear lucency that we're talking about and that we saw on the scan, did that show any signs of healing?
Not from the 3D reconstruction, but we don't always see it on 3D reconstruction, so.
Okay. Thank you.
Mr. Stryan, do you wish to ask any questions?
No, Your Honor.
I'm concerned that by allowing the question and allowing Dr. Lakin to come back to the stand and testify, that it doesn't seem to me, if I understand correctly, your opinion is that you can't really say whether there's any healing because basically you're looking at what the CT scan operator said on the thing.
Correct.
And you're relying on that.
And
I think it's inconclusive enough that I should exclude this question being asked in front of the jury. Mr. Stranz, all right. I just wanted to do this on the record so I can find out for sure what the right answer is, and now that I have what I think is the correct answer. I'm going to instruct the jury that when the jury comes back, we're going to have Agent McGowan come back to the stand so he's seated there as he was when they left. And then if you'll just step down, then I'm just going to tell him that I've considered the question that was asked. I'm not going to repeat that question to the jury because it's only one individual juror, but that I find that this witness is not the correct person to have answered that question, and that they can only consider what the proof has been offered. So. All right, bring the jury in. All right, everybody's claimed their seats again. Ladies and gentlemen, the reason I sent you out was that I was handed another question by one of you, and I have considered that question on the record with the attorneys. And the question that was asked is not a question that this witness can answer, and that the proof that's been offered up to this point would contain the information that would answer that question likely. And so for that reason, I'm not going to allow that question to be asked of this witness. So do you have any other questions for Agent McGowan? No. Any other questions for Agent McGowan?
No, Your Honor, thank you.
And Agent, you may step down. Thank you. We're about at the lunch hour. Do you have any other proof you wish to offer?
Your Honor, at this time, the state will rest.
All right, ladies and gentlemen, the state has rested. We'll go ahead and take our lunch hour. Let's be back at 1:15 to resume with our trial. 1:15. I will remind you of your instructions not to think about this case or talk about it among yourselves or try to do any research. Please don't let anyone talk to you about this case. And if you'll exit through this door, and then they'll take you out through a different way. We stand at recess for lunch until 1:15. Mr. Strines, I understand you may want to have some issues that we need to address on the record.
That we're at the end of the state's proof, I am required and will make a Rule 29B, Tennessee Rules of Criminal Procedure motion for judgment of acquittal where we are right now in this record, it's a case of possibilities. We have a linear lucency that was found in the skull of Olivia Hyde that was suspicious for fracture. And then when Dr. Lakin did her report in February of 2025, she layered on another possibility, a quote, possible concussion. I know that the standard of that the court has to view a motion for judgment of acquittal at this time of the proceedings, that the state gets the benefit of the court viewing the evidence in the light most favorable to the state. And I know that the court is very familiar with the elements of aggravated, which is alleged in count 1 of this indictment that we've been dealing with this week. And I just, for the record, want to put on the record that the first element of that offense of aggravated abuse in Tennessee is that the defendant knowingly, other than by accidental means, treated a child in such a manner as to inflict injury. Where we are right now at the resting of the state's case, I would respectfully submit, is really in sort of a no man's land of possibilities. We have a linear lucency that's suspicious, and we have a possible concussion. And the court will have to decide whether those possibilities are enough to send the case to the jury. It may be that this is a case that the jury will decide, but I did want to point that out for the record, and consistent with Rule 29B would move for a motion for judgment of acquittal.
They have a response. More?
All right, please, court. Certainly agree that standard of the law, as well knows, is taking this matter in the light most favorable to the state, submit that the jury, from what they have seen and what they have heard, there is a sufficient basis for the jury to return a verdict of guilty on both counts, but with respect to the count 1, aggravated video shows other than accidental means, knowingly, and the definition of serious bodily injury to a child is set out in the statute, is like sort of aggravated assault, has numerous ways that could be committed as serious bodily injury. So the state has presented proof based upon the evidence, the testimony, particularly of Dr. Lakin, that those elements should go to the jury. This is a matter where the state, at this point in the trial, submits that we have carried our burden of going forward when taken in the light most favorable to the state. Thank you.
All right, I have considered the evidence, and I do find that there has been sufficient evidence presented, again, considering it as I'm required to in the light most favorable to the state's position, that there is sufficient evidence that the matter should continue and that the jury should have an opportunity to consider it. I do find that the photographs of bruising, as well as the video of the incident that occurred during the nap time taken with Dr. Lakin's testimony, do constitute sufficient basis for the jury to consider these charges, and that for that reason the court respectfully denies the motion for judgment of acquittal. Ms. McKinney has been working on the final charge, not to presuppose anything because I know you have several witnesses that you're going to call, but I wanted to make sure that you understand that once she's going to run a draft, and I would like for you all to look it over at some point and let me know if there's any changes or alterations or requests that you would make in addition to what's in there. So we generally go by the Tennessee pattern jury instructions. So it'll be, what's going to be in there is going to be exactly what those pattern instructions provide, but we'll let you look at it and we'll see from there. All right, we're in recess then until 1:15.
Okay, so they zoomed in on some of the videos, and you can see when she appears to hit her head, and then the little one goes to sleep, just out like a light, and doesn't move. And the thing that bothered me is that she didn't even check on her. She didn't recognize that as something that is odd. That doesn't happen. You know, they don't just immediately flip off like a light. They don't do that. People don't do that. So why didn't she check on her to see if she was okay? And the other thing I noticed was there was another little one that was doing the exact same thing, but she didn't get the same treatment. I'm very glad that she didn't. I mean, thank the good Lord that she did not get that kind of treatment. But my question is why? Why this one? And my mind goes to different places, but this one thing I thought of is Mom is very pretty. She's a very beautiful woman. And maybe this daycare worker was jealous. And so she was irritated and angry that this pretty woman comes in, and so she wants to take it out on her daughter. I don't know that, obviously, and that's not anywhere in this case, but it just made me think about that. You know, there are people out there that will do stuff like that, and that bugs me. I hope that's not it, but I noticed that, and I thought, I wonder why. What could this little Olivia have done to warrant that? Anyway. Part 2, the prosecution rests, so the afternoon picks up with the defense. So I'm going to try to get that out tonight before I go to sleep, but it is going on 9 o'clock, so we'll see. Thank you guys so much for watching part 2. Stay tuned for part 3.